Did you know that the little tablet you reach for when you have a headache might actually do a lot more than just relieve pain? Aspirin, a common household name for treating headaches, has some pretty impressive benefits for your heart health too. It's not just about easing discomfort. Aspirin plays a significant role in preventing heart attacks and strokes. How, you ask? It all comes down to how aspirin interacts with your blood. Aspirin helps to keep your blood flowing smoothly by preventing blood clots, which is crucial for maintaining open and healthy arteries. But there's more to the story. Can taking aspirin regularly really make a long-term difference in your health? In this video, we'll explore exactly how aspirin works to unclog arteries and improve cardiovascular health, and whether integrating it into your routine is the right move for you. So, let's dive in and uncover the heart-smart secrets of this everyday medicine. Let's take a moment to explore the fascinating history behind aspirin. The journey begins long before it became the common medicine we know today. Ancient civilizations recognized the healing powers of willow bark, which contains salicylic acid, the active ingredient in aspirin. Egyptians and Greeks, including the famous physician Hippocrates, used extracts from this bark to relieve pain and reduce fever. Fast forward to 1897, German chemist Felix Hoffmann made a groundbreaking discovery while working for Bayer. He synthesized pure acetylsalicylic acid, or ASA, effectively creating what we now call aspirin. This innovation was more than just a scientific achievement. It paved the way for aspirin as a remarkable remedy with diverse health benefits. By 1899, Bayer began distributing aspirin to doctors, and it quickly gained popularity. By 1915, it was available to the general public, transforming the way many approached pain relief and, eventually, cardiovascular health. Today, aspirin is celebrated not just as a pain reliever but also as a key player in heart health, making its historical roots even more significant. Aspirin is more than just a pain reliever. It has a fascinating mechanism that plays a vital role in heart health. Its action in the body can be understood in two main ways: low doses for preventing blood clots and high doses for reducing pain and inflammation. When taken in low doses, aspirin works primarily as an antiplatelet agent. It achieves this by inhibiting an enzyme called cyclooxygenase, or COX. This inhibition reduces the production of thromboxane, a substance that encourages platelets in your blood to stick together. By preventing this platelet aggregation, aspirin effectively lowers the risk of blood clots forming. Blood clots can block arteries, leading to critical events like heart attacks or strokes. So, using aspirin daily can provide a protective effect, especially for those at risk of cardiovascular issues. On the other hand, when taken in higher doses, aspirin acts more like a traditional pain reliever. It blocks the production of prostaglandins, which are chemicals in the body that promote inflammation, pain, and fever. By inhibiting these substances, aspirin helps reduce pain and inflammation, making it effective for various conditions, from headaches to arthritis. The dual action of aspirin is what makes it so special. At low doses, it acts as a shield for your heart, helping to prevent artery blockages, while higher doses can provide relief from discomfort and inflammation. Understanding these mechanisms helps us appreciate how something as simple as aspirin can have profound effects on our health, especially in safeguarding cardiovascular well-being. Aspirin's benefits extend beyond pain relief, offering significant advantages for cardiovascular health, cancer prevention, and even pregnancy complications. Let's explore these proven benefits in more detail. For cardiovascular protection, regular low-dose aspirin can be a game-changer. Studies have shown that it can reduce the risk of heart attacks and strokes by up to 20% in individuals at high risk. This includes people with existing heart conditions or those with risk factors such as diabetes, high blood pressure, or obesity. Aspirin's ability to prevent blood clots is key here, as it helps maintain healthy blood flow and prevents blockages in the arteries that could otherwise lead to these serious cardiovascular events. Beyond heart health, aspirin is a well-established pain reliever. It's highly effective for managing acute pain like headaches, toothaches, and menstrual cramps. Moreover, aspirin is also used in the management of chronic inflammatory conditions such as arthritis, where its anti-inflammatory properties help alleviate pain and stiffness. Emerging research also points to aspirin's potential in cancer prevention. Long-term use has been linked to a reduced risk of certain cancers, particularly colon, rectum, and stomach cancers. This protective effect is thought to be related to aspirin's ability to reduce chronic inflammation, a known contributor to the development of cancer. Furthermore, aspirin plays a role in preventing preeclampsia, a serious complication that can occur during pregnancy. By improving blood flow to the placenta, low-dose aspirin helps reduce the risk of this condition in high-risk pregnancies. This benefit is particularly significant, as preeclampsia can have serious consequences for both the mother and the baby. While aspirin offers numerous benefits, it's essential to be aware of the potential side effects and risks associated with its use. Understanding these can help you make informed decisions about whether aspirin is right for you and how to use it safely. One of the most common side effects of aspirin is gastrointestinal bleeding. This occurs because aspirin can irritate the stomach lining, leading to discomfort or bleeding. To minimize this risk, it's recommended to take aspirin with food. Avoid chewing the tablets, as this can increase direct contact with the stomach lining and worsen irritation. If you have a history of stomach ulcers or other gastrointestinal issues, consult your doctor before taking aspirin. They may recommend protective measures or alternative medications. Aspirin can also increase your overall risk of bleeding. This means you might bruise more easily or experience prolonged bleeding during surgeries or dental procedures. Women may also notice heavier menstrual bleeding. It's crucial to inform your doctor about your aspirin use before any medical or dental procedure, as they may advise you to temporarily discontinue its use to minimize bleeding risks. Allergic reactions to aspirin are possible, although less common. People with asthma are particularly susceptible to these reactions, which can manifest as skin rashes, itching, or difficulty breathing. In rare cases, a severe allergic reaction called anaphylaxis can occur, requiring immediate medical attention. A serious concern, especially for children, is Reye's syndrome. This rare but potentially fatal condition can develop in children and teenagers recovering from a viral infection, such as chickenpox or the flu, who have taken aspirin. Because of this risk, aspirin is generally contraindicated for children and teenagers with viral infections. Always consult a doctor before giving aspirin to a child. While these side effects and risks are important to consider, they shouldn't necessarily deter you from using aspirin if your doctor recommends it. Open communication with your healthcare provider is key. They can help you weigh the potential benefits against the risks and determine the most appropriate course of action for your individual health needs. Remember, responsible and informed use is essential to maximizing the benefits of aspirin while minimizing potential harm. Aspirin can be a valuable tool for preventing cardiovascular issues, but it's not for everyone. Let's clarify who should and should not take aspirin, emphasizing the importance of personalized medical advice. Generally, individuals with a history of heart attacks, strokes, or other cardiovascular conditions are often advised to take low-dose aspirin regularly. This is because aspirin's anti-clotting properties can help prevent future cardiovascular events. It acts as a protective measure, helping maintain blood flow and reduce the risk of blockages. High-risk pregnant women may also be prescribed low-dose aspirin to prevent preeclampsia, a serious pregnancy complication characterized by high blood pressure and potential damage to organs, including the liver and kidneys. Aspirin can help improve blood flow to the placenta, reducing the likelihood of this condition developing. Individuals with multiple cardiovascular risk factors, such as high blood pressure, diabetes, high cholesterol, obesity, or a family history of heart disease, might also benefit from low-dose aspirin therapy. However, this decision should be made in consultation with a doctor, carefully weighing the potential benefits against the risks. On the other hand, low-risk individuals without major cardiovascular concerns might not need to take aspirin regularly. The potential risks, such as gastrointestinal bleeding, might outweigh the benefits in these cases. It's always best to discuss with a doctor whether aspirin is necessary for primary prevention, meaning preventing a first heart attack or stroke. Children and teenagers, especially those recovering from viral infections like chickenpox or the flu, should generally avoid aspirin due to the risk of Reye's syndrome, a rare but severe condition affecting the brain and liver. People with a history of ulcers or gastrointestinal bleeding should be cautious about taking aspirin. The drug can irritate the stomach lining and potentially worsen these conditions. In such cases, a doctor might recommend alternative medications or strategies to manage cardiovascular risks. Ultimately, the decision of whether or not to take aspirin should be made in consultation with a healthcare professional. They can assess your individual risk factors, medical history, and potential benefits and drawbacks to provide personalized guidance. Self-medicating with aspirin is strongly discouraged. A doctor's recommendation is essential to ensure safe and effective use. Aspirin can interact with several other medications, potentially increasing the risk of side effects. It's crucial to be aware of these interactions to ensure your safety. If you're taking other nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen, combining them with aspirin can significantly increase the risk of gastrointestinal bleeding. This is because both aspirin and NSAIDs can irritate the stomach lining, and their combined effect can exacerbate this issue. Taking aspirin with anticoagulants, often referred to as blood thinners, such as warfarin, can also heighten the risk of excessive bleeding. Both medications work to prevent blood clots, and their combined effect can make it harder for your blood to clot normally, potentially leading to serious bleeding complications. Combining aspirin with corticosteroids, commonly used to reduce inflammation, or certain antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, can elevate the risk of ulcers and bleeding in the stomach and intestines. This is because these medications can also irritate the digestive system, and when taken with aspirin, the risk is amplified. Given the potential for interactions, it's essential to inform your doctor about all the medications, supplements, and herbal remedies you're taking before starting aspirin therapy. This includes over-the-counter drugs and vitamins. Your doctor can assess the potential for interactions and adjust your medication regimen accordingly to minimize risks. Never combine aspirin with other medications without first consulting your doctor or pharmacist. They can provide personalized advice based on your specific health situation and medication list. The potential benefits of aspirin extend beyond its well-known uses, with exciting new research shedding light on its future applications. In cancer prevention, ongoing studies are investigating aspirin's ability to reduce the risk of gastrointestinal cancers, such as those affecting the colon and stomach. The anti-inflammatory properties of aspirin may play a significant role in hindering cancer development by reducing chronic inflammation, which is a known cancer risk factor. Researchers are also exploring aspirin's potential in dementia prevention, particularly Alzheimer's disease. Some studies suggest that aspirin could help reduce neuroinflammation, which is thought to contribute to the progression of Alzheimer's. By mitigating this inflammation, aspirin might help protect brain health and slow the disease's advancement. The field of pharmacogenetics is opening up new possibilities for personalized aspirin therapy. Scientists are examining how genetic factors influence an individual's response to aspirin, aiming to tailor treatment plans that maximize effectiveness while minimizing risks. This personalized approach could ensure that patients receive the most benefit from aspirin, with fewer side effects. In an effort to make aspirin use safer, especially for long-term users, researchers are developing new delivery systems. These include coated tablets designed to minimize gastric irritation and reduce the risk of gastrointestinal bleeding. Such innovations could make aspirin a more viable option for a broader range of people, allowing more individuals to benefit from its protective effects without experiencing adverse side effects. Using aspirin effectively and safely requires following practical guidelines tailored to your specific health needs. Let's discuss some key points to consider for optimal aspirin use. First and foremost, it's important to adhere to the dosage prescribed by your doctor. The appropriate dose can vary depending on why you're taking aspirin, whether it's for heart health, pain relief, or another reason. Never adjust your dosage without consulting your healthcare provider, as taking too much can increase the risk of side effects, while taking too little might not provide the desired protective effects. When it comes to administration, always take aspirin with food. This practice helps to protect your stomach lining from irritation, reducing the risk of gastrointestinal issues like ulcers and bleeding. Also, avoid chewing or crushing aspirin tablets unless specifically instructed to do so by your doctor. This ensures the medicine is properly absorbed in your system and minimizes direct contact with your stomach lining. If you're scheduled for elective surgery, it's usually recommended to stop taking aspirin about 7 days prior, or as directed by your healthcare provider. This is because aspirin's anti-clotting effects can increase the risk of bleeding during surgery. Always discuss your aspirin use with your doctor well in advance of any surgical procedures so they can provide specific guidance based on your individual situation. Regular monitoring is an essential part of long-term aspirin therapy. Your doctor may suggest periodic checkups and blood tests to keep track of how aspirin is affecting your body. These assessments can help ensure that the medication is working as intended and allow your doctor to address any potential side effects early on. In summary, careful adherence to these practical guidelines can help you maximize the benefits of aspirin while minimizing potential risks. Always maintain open communication with your healthcare provider and seek their advice if you have any questions or concerns about your aspirin regimen. This proactive approach helps to ensure that aspirin remains a safe and effective component of your healthcare plan. In conclusion, aspirin is a powerful medication that offers numerous benefits, such as cardiovascular protection, effective pain relief, potential cancer prevention, and a reduced risk of preeclampsia in high-risk pregnancies. However, it's essential to remain vigilant about its risks, including gastrointestinal bleeding and allergic reactions. Before starting or stopping aspirin therapy, it's crucial to consult with your doctor. They can help determine whether aspirin is right for your specific health needs, ensuring that you maximize its benefits while minimizing potential downsides. If you found this information helpful, we encourage you to subscribe for more health-related content. Staying informed is a vital part of maintaining your health and well-being. Thank you for joining us today, and we wish you all the best on your journey to better health and happiness. Stay healthy and take care.